Infection Prevention and Control Unit in Kenyatta National Hospital does not just stop its care at the hospital. We go and we strive to go beyond the hospital to the community, because if we do not take care of the community, then we will have the patients come back to the hospital very frequently. Home-based care is a situation where a patient who meets the criteria that is set by the Ministry of Health is allowed to go and get well right at the comfort of their home. And the eligibility criteria is stipulated as follows. This patient is asymptomatic, as in does not have those signs and symptoms that may warrant him or her to be put in a hospital bed. But the lab confirms that this patient is COVID-19 positive. Then this is a patient who does not have the comorbidities. Just to mention a few, like diabetic, hypertensive, or has a cardiovascular or a heart condition. Then this is a patient who can afford to have an isolation facility right at home. And so, when we are discharging these patients, we need to see, other than being eligible, how does that care continue at home without infecting the family members. This patient will have to be taken through an interview where we see that we can be able to isolate this patient in a room alone, has a few of the facilities that are needed to himself. And then again, this same person should ensure that has identified a caregiver. The facilities such as a toilet, preferably the toilet that patient should use alone, the bedroom should use it alone. The caregiver should be able now to walk around the house and facilitate this patient in matters food, matters getting clothes washed, and all that. So this caregiver actually is the one who will actually stay with the patient, ensure that the patient is feeding, the normal running of the patient. See, this is a person you can send to the bank if there must be something to be done in the bank. So basically, the function of these patients are not like stopped, because this caregiver is the one running those errands. So at the point of discharge, there are a few things that will be given to this patient. One, we will need to have the hypochlorite solution, because this is a good decontaminant which needs to be available in the homestead, because this is what will be used to clean the homestead. The other thing is the surgical masks. We need the patient to have a packet of surgical masks. This is for him and for the family members, because these family members will be expected to be in surgical masks up to a time of 10 days. That is when the patient stops shedding the virus. Then there will be a gun thermometer, which the caregiver will keep checking the temperature of this patient every morning or the agreed time, and keep recording it. If it is possible, then there are those who can afford an SpO2 measure, which measures the oxygen saturation in the body, and the caregiver will be instructed at the point where you get to know that the oxygen saturation goes beyond 85 millimeters of mercury, then you need to take this patient to the hospital. The caregiver is actually the person who fits into this patient's shoes. This is the person who will ensure that the normal family running activities are still running, even as this patient is isolated in that room. For example, we'll need to ensure that the food is available and even cook and feed the patient. The family members should eat, and it is the caregiver who should be able to avail this. Running errands for the patient. So basically the patient does not stop functioning. At the same time, this caregiver is the one who ensures that the homestead is still safe. This is the person who will ensure the cleanliness of that homestead. The surfaces are well disinfected, the high touch areas are well disinfected, and everyone is fitting into the surgical mask and keeps checking if there are children around or everyone who is in the home. The caregiver preparing a plate full of fruits for the patient and the family. So the caregiver comes from the market with the fruits, gets into the kitchen, washes the hands, and then goes ahead to wash the fruits, cuts the fruits, and makes them ready to be served. The caregiver then proceeds to the patient's bedroom, where the patient is isolating. And so outside the bedroom, there's a table where we can place the food. We have the gun thermometer right there, and then we have the papers where they document the daily temperatures. So gets in there, knocks at the door, and so the patient who has isolated fits into a surgical mask and comes to the door. And now a small interview is conducted by the caregiver, whereby the caregiver may want to know how did you sleep, just to make the patient feel together with the family, how was your night, how are you getting on. And at that point, the caregiver takes the temperature and records. The caregiver ensures that there is a bucket under that table where the patient, after feeding, will come and place the utensils, which will be collected from there back to the kitchen, because this bucket actually has the hypochlorite for soaking, and these utensils should stand there for like 10 minutes. So these utensils are safe and being taken back to the kitchen for washing with soap and water, and they are fine. You do not have to isolate the utensils for this patient as long as they've been soaked and washed with soap and water.
Home-based care is the way to go, considering that this COVID-19 is going to be with us for some time and the hospitals are going to be overwhelmed. That's why the government has brought about that policy of home-based care. And the advantage is that the patient is able to heal in his or her own environment, surrounded by the loved ones. Infection prevention and control takes care of the staff and the patient at the hospital, and we are also concerned about the care of the patient at the community level.